Wel, gyfeillion, ydych chi wedi cael profiad sydd wedi newid eich bywyd chi? Ydych chi sefyllfa ble mae yna un foment mewn hanes wedi newid holl gwrs eich bywyd? Dwi wedi. 45 mlynedd yn ôl i fis Mawrth diwetha, fe ddigwyddodd rhywbeth wnaeth newid cwrs y mywyd i. Do'n i heb gael yngeni ar y pryd ac o'n i'n ddim mwy na hanner maint fy nwrn yng ngwroth fy mam pan gafodd hi anffawd yn neuadd Sam Pedr Caerfyrddin. Anffawd oedd yn golygu bod hi bron angholli i pan oeddwn i yn y groth. Gafodd hi brysio i'r ysbyty yng Nghlangwili ac yno, a minna i ddim hyd yn oed yn ymwybodol o modolaeth i, y does ar draws yr NHS gyntaf, wrth i'r meddygon a'r nyrsys yno fynd ati achub y mywyd bach bregus i ar y pryd. Mae'n saff dweud heb ymroddiad ac arbenigedd a cariad y gweithlu yma na faswn i yma'n sefyll o'ch blaen chi y bore yma. Mewn gwirionedd, dwi wedi cael sawl achos i ddiolch i'r NHS ers hynny, credwch chi fi. Ac wrth gwrs mae gan bob un ohono ni reswm i ddiolch i'r NHS yn un gwahanol ffyrdd yn does. Ond mae yna rhywbeth di mynd o'i le. 4 mlynedd yn ôl, roedd y gweithlu'r Gwasanaeth Iechyd yn gweithio hyd eithaf ei gallu i achub bywydau yn wyneb yr haint mwyaf marwol sydd wedi wynebu dynoliaeth mewn canrif, a nifer anghymesur o'r gweithlu iechyd wedi marw o'r haint yma. Ond gwta 2 flynedd ar ôl y gwaith arwrol yma, roedd degau o filoedd o'r gweithlu ar streic. Sut ddaru ni gyrraedd sefyllfa o'r fath? Roedden nhw'n gweithredu ein lles ni. A pha syndod ei bod nhw'n pryderu am ein lles ni pan fod rhestrau aros ar ei hyraf erioed, gyda nifer o bobl yn dioddau poen a diriwiad yn ansawdd eu bywydau. Mae bron i 1 o bob 5 ohono ni yng Nghymru bellach a restr aros am driniaeth feddygol. Mae bron i hanner cleifion canser Cymru ddim yn derbyn eu triniaeth ar amser. Mae amseroedd ymateb yn ambulances ni ymhell y tu ôl i ble dylien nhw fod. Mae pob un o'r 7 bwrdd iechyd lleol mewn rhyw fath o fesurau arbennig. Ac mae targedau perfformiad yn cael eu methu mor aml fel bod y targedau hun bellach yn gwbl ddibwynt. Canlyniad hyn, wrth gwrs, ydy gweithlu sydd yn digaloni a chleifion sydd yn cael eu gadael i lawr gan system sydd yn methu gweithredu i'w lawn potensial. Rwan mae'r Llywodraeth yn sydyn iawn i restru ystadegau o'r niferoedd anferthol o bobl sydd yn ymweld ag adrannau brys neu'n ffonio 111 yn ddyddiol, a hyn fel tystiolaeth o lwyddiant y gwasanaeth o dan i rheolaeth nhw, medden nhw. Ond nid llwyddiant ydy hyn, mae'n arwydd o fethiant. Mae pobl yn ffonio 111 ac yn ymweld ag adrannau brys oherwydd fod y Llywodraeth wedi methu a buddsoddi yn ein gwasanaeth cynradd a gofal. Ystyriwch un o fetholwyr, oedd angen penglin newydd. Oherwydd y rhestr hirfath, roedd o'n gorfod mynd i'r meddyg bob ychydig fusoedd mwyn cael brechiadau lladd poen. Roedd o'n rhoi pwysau ymlaen ac yn beryg o fynd yn ordew, ac roedd ei iechyd meddwl yn dioddef yn ddifrifol ac yn gorfod cael cymorth meddygol oherwydd hyn. Roedd y methiant i sicrhau un triniaeth penglin yn arwain at ddwsinau o gysylltiadau eraill efo'r Gwasanaeth Iechyd. Ac mae hyn yn digwydd ar raddfa anferthol ar draws y wlad. Y canlyniad anochel wrth gwrs i'r etholwr yma oedd ei bod wedi gorfod mynd yn breifat fel cynifer o bobl. Gyfeillion, y gwir ydy o dan llafur mae gynnon ni wasanaeth iechyd ddwy haen erbyn hyn. Gwasanaeth prydlon ar gyfer y rhai sydd yn gallu fforddio, a gwasanaeth hir ddisgwyliedig yn arwain at ddirywiad mewn safon byw a iechyd personol i bawb arall. Dyma ydy gwaddol 25 mlynedd o Lywodraeth Lafur yn rheoli ein gwasanaeth iechyd yng Nghymru. A wyddwch chi, o ystyried y 25 mlynedd yna, o ystyried y Senedd heddiw a'r grŵp llafur sydd gynnon ni, wyddwch chi fod 20% o'r grŵp llafur presennol yn gyn-weinidogion iechyd? 20% ohonyn nhw, ac mae pob un ohonyn nhw wedi dod i'r swydd yn ei tro yn addo lleihau y rhestrau aros ac yn angadael gyda'r rhestrau aros wedi cynyddu. Wan, does ddim gwadu maint yr heriau sydd yn wynebu'r Gwasanaeth Iechyd. Mae effaith y pandemig yn parhau i gael ei deimlo ar draws ein cymunedau. Mae gynnon ni boblogaeth sydd yn fwy sâl ac yn hŷn na gwledydd a rhanbarthau eraill y Deyrnas Gyfunol. Ac mae'r tueddiadau demograffig yma yn dwysau. Ond yn hytrach na chymryd cyfrifoldeb a chanfod datrysiadau, mae'r Llywodraeth Lafur yn beio pawb a phopeth arall o reolwyr y Gwasanaeth Iechyd, y gweithlu, y colegau brenhinol a hyd yn oed y cleifion. Nhw sydd ar fai, nid y Llywodraeth Lafur medden nhw. Un o'r polisïau mwyaf niweidiol i'r sector iechyd a gofal dros y 15 mlynedd diwetha oedd polisi creulon llymder y cydwadwyr. Mae'r argyfwng yn y sector gofal heddiw yn ganlyniad uniongyrchol i 15 mlynedd o doriadau sydd wedi llesteirio o gallu i ddarparu gofal, gyda thoriadau llym i wasanaethau anstatudol, ond a oedd yn oll yn cynorthwyo pobl oedd ar y trothwy o angen gofal. Prosiectau ataliol hanfodol sydd bellach wedi diflannu a'r gwasanaethau gofal ei iechyd sydd yn talu'r pris heddiw. A beth ydy ymateb Llywodraeth Lafur newydd San Steffan? Mwy o lymder. Gyda Rachel Reeves yn sôn am doriadau o dros 20 biliwn o bunnoedd yn ychwanegol a Starmer yn dweud nad ydi o am adolygu'r fformula Barnett a sicrhau ariannu teg i Gymru. Yn hytrach na sefyll cornel Cymru a dadlau'n hachos, mae Llywodraeth y Baroness Morgan wedi penderfynu peidio a herio ei meistri'n Llundain gan dderbyn y cyfan yn llipa. We've also witnessed Labour members in the Senedd line up rank and file to reaffirm their UK leadership's callous and counterproductive decision to withdraw the winter fuel allowance. And what has this got to do with our NHS? The NHS spends at least £2.5 billion a year treating people with illnesses directly linked to living in cold, damp and dangerous conditions. Over 25,000 people die each year in the UK as a result of living in cold temperatures, such as living in poorly heated homes. The most common ailments seen for poorly heated homes are circulatory diseases, respiratory problems, and mental ill health. Other conditions which are influenced or exacerbated by cold housing include the common flu and cold, as well as arthritis and rheumatisms. These would most likely lead to increased GP appointments, A&E visits, potential hospital inpatient stays, and the need for social care service support. The callous decision by the UK Labour government to cut the winter fuel payments will cost a lot of people dearly and will add significant pressure on our NHS during the time of year when demand is at its peak. And in the ultimate sign that the Labour Party in Wales has abdicated responsibility, they have now effectively outsourced the task of managing waiting lists to the UK government, betraying the founding principles of devolution. Now, there are no easy solutions for this crisis. Fixing the foundations of our NHS will take many years of hard work. But conference, I wouldn't be standing here today if I didn't believe with every fibre of my being that a brighter and more sustainable future for the NHS is possible, and we must be the ones to deliver it for the people of Wales. It's up to us to step up to the mark and offer the transformative vision that the people of Wales desperately crave. This is about getting the basics right and rebuilding the foundations of our health and care systems. First and foremost, a Plaid Cymru government will do this by ensuring that the preventative agenda is front and centre of everything we do as a government. Over the past decade, the Welsh Government under Labour has shifted ever-increasing resources away from primary care and programmes designed to promote healthier lifestyles to plug gaps at the beleaguered front line. You don't need a £2,500 pair of glasses from a wealthy benefactor to see that this is a completely false economy. This will consume ever more resources without alleviating pressures on frontline services. While the Labour Party is in the business of managing sickness, a Plaid Cymru government will be in the business of keeping people healthier for longer. A Plaid Cymru government will create a new ring-fenced departmental expenditure limit within the Welsh budget for preventative programmes, which we will commit to increasing every single year throughout the next Senedd term, thus enhancing access to sports facilities, playing fields, healthy eating programmes and mental health and well-being initiatives. We'll restore the bonds of primary healthcare by uplifting the number of GPs in Wales to the OECD average. This will entail recruiting an additional 500 GPs to this perennially underappreciated workforce, as well as redoubling efforts to retain the talent we have already, while ensuring that primary care gets an increased share of the health funding. We also need to tackle the shocking reality that the NHS is literally crumbling. Over 60% of our hospitals predate the devolution era, and 11% are older than the NHS itself. And in recent years, the maintenance backlog of the estate has ballooned enormously, with costs associated with high-risk issues alone reaching £250 million. As was starkly illustrated by the recent testimony of the Chief Medical Officer for Wales at the UK COVID inquiry, the ageing and dilapidated nature of the estate has alarming implications for staff and patient safety alike, and is inherently undermining long overdue efforts to digitalise health infrastructure and boost workforce productivity. We will put into action a new 10-year investment plan for the NHS estate in Wales by first tackling the desperate maintenance backlog. But rebuilding the foundations of the NHS isn't just a case of replacing bricks and mortar either. The fact that all 7 of the major health boards in Wales are in a form of special measures, with some having been in this position for many years, underscores the urgent need for institutional reform to end the normalisation of failing standards. This means initiating a comprehensive restructuring of governance architecture in the health system. A Plaid Cymru government will empower the NHS executive as a body with a clear mandate for day-to-day operations in the health service, and with a primary responsibility for overseeing escalation and intervention measures, depoliticising the process. We will no longer see troubled health boards de-escalated for political expediency because of an election that is on the horizon. A Plaid Cymru government will review performance targets to ensure they are no longer simply ornamental, but have a real meaning and are properly aligned to resources. And we launch a recruitment drive to enhance specialist knowledge of healthcare governance within the civil service. We'll also establish a professional regulatory body for NHS Wales and a set of statutory and enforceable professional standards for all NHS managers. These measures may not be the most glamorous or eye-catching, but they're essential for getting the basics done and done well. We'll also ensure that the process of bringing care closer to the community is more than just a slogan. Because as we all know, hospitals shouldn't be the be-all and the end-all when it comes to the provision of healthcare. And yet, when we consider the current situation whereby far too many people are getting stranded for days on end in hospital beds, despite being well enough to be discharged, it's abundantly clear that the disconnect between the front line and social care has yet to be satisfactorily addressed. So we'll finish what we started through the cooperation agreement by creating a fully integrated national care service for Wales, where both major branches of the health and social care sector are working together in concert. As the first steps towards this, we must enhance the prestige of the social care workforce, which, despite being a vital pillar of the welfare state, has been underappreciated for far too long. This is why we look to uplift the real living wage for paid social care workers by £1 per hour, taking us closer to the eventual goal of aligning their wage bands fully with the NHS pay scales. And in addition to the salaried social care workforce, we will be the most vocal and unstinting champions in government of unpaid carers, who contribute billions of pounds to the Welsh economy each year, despite often having to face formidable personal hardships. We'll show this in deeds as well as words by revising the needs-based assessment criteria of unpaid carers to better reflect their housing needs, and provide greater flexibilities and opportunities around studying and personal development. Finally, we'll embrace innovation to push the boundaries on how healthcare intersects with our lives, such as increasing the number of rapid diagnostic clinics in Wales for cancer screening, opening a new dental school to train more dentists, and trial virtual wards for elder care at home, while also improving digital access to health records. Dyma gamau y gellir ei cymryd I wella ansawdd a darpariaeth, a hynny heb yr angen am fuddsoddiad o biliynau o bunnoedd yn flynyddol. Mae gan Plaid Cymru weledigaeth drawsnewidiol fydd yn codi safonau ac yn byw I fyny i'r weledigaeth o sicrhau gwasanaeth iechyd a gofal cenedlaethol am ddim i'n dinasyddion. A fedrai ddweud o hyn wrthych chi heddiw, gyfeillion, mi fydd Llywodraeth Plaid Cymru yn un hynod o gyffroes. Diolch yn fawr iawn I chi.